Retired General Rick Hillier, who of course is overseeing the rollout in Ontario. First of all, great to have you back on the program, General Hillier, and thanks for your service to the country. Let me just start with the update. Can you roll out the timeline for people classified as immediate priority? How does this work?
Yeah, so Evan, we've been doing a lot of work over this last month, obviously, because we've been in a drought for vaccines, as you know, and it's kind of a month almost with minuscule number of vaccines in Ontario. Most frustrating. We're rolling out right now to go back through the long-term care home residents and the high-risk retirement home and elder long-term care facilities. Go back through, get the second needle brought to the residents and the staff who have already had their first needle, and to pick up then the staff that we did not have enough vaccines to be able to give the first needle to in some parts of Ontario. So that part we want to finish off and bring that level of protection to that entire group that we want to. Secondly, we want to, re-accelerate our highest risk healthcare workers, those patient-facing healthcare workers, and get to them. And thirdly, we're running what we call Operation Remote Immunity to vaccinate in the isolated fly-in only communities in the north. We've done about 6,500 vaccinations up there already, but now we also want to make sure that the First Nations in the reserves in communities across Ontario, particularly southern Ontario, prioritized by them, by their leadership, that we start there also. And then, of course, as we roll through into early March, we want to bring the 80-year-old plus into that group also. We want to give them that level of protection. So that's how we're rolling out. We're into what I've been calling a transitional phase here between sort of phase one, finish off those priority populations and get to bigger doses arriving in Ontario on or about the 1st of April, and then transition into phase two.
Let's talk about those 80 and up. So they're the next priority. How do you contact a lot of those folks who, they're not online? Are they going to get vaccinated? Do they have to go to some places? Or is part of the plan to get the general practitioners, the family doctors, the primary caregivers to get involved? I know that's more difficult with the Pfizer vaccine because of the cold chain storage issue, but how do these folks, many of them who aren't online, how are they going to find out about this and get it?
Well, first of all, it's a great challenge. There's no doubt about that, but in a whole variety of ways. Number one, there are going to be commercials and public service announcements of telling them what to do. Number two, in the next couple of weeks, we'll have a call center going on duty. So for those who are not online, and obviously probably a percentage of that population, a bigger percentage is not online, there is a call center that will be available. We're racing to get that set up and go live with it. And then thirdly, we are putting in to go live somewhere around the 1st of March, an online pre-registration service and then a reservation service. And so the ideal is those who are mobile come to the vaccination clinics, and they'll include, yes, the primary care providers, it'll include pharmacies, and it will include mass vaccination clinics. And so it'll be all of that because we want to be able to turn on the great medical capacity in the province of Ontario. And so we'll do all of those things for them. If they're mobile, if family members can help get them out, if caregivers can help get them out of their homes and be able to come, that makes it so much easier. It really is difficult to go into a home and vaccinate one person because both Moderna and Pfizer, you're not going to transport in the syringes. So it really is a challenge. We'll get around it. We're going to make sure that group gets vaccinated. We'd like to do it as quickly as possible. And I would just commend, Evan, that, look, families, church groups, community groups, reach out to those people that are part of your population and make sure they know that this is coming, make sure they know the way to get registered and help them out. Right.
Well, they also got to know where to go. The plan's got to roll out. But this memo is also included a directive about vaccine equity, saying anyone filling a no-show or a cancellation should be immediate or the next priority. How does that work? So let's say someone's registered, they don't show up. At the end of the day, you've got a couple vaccines left over. What's the plan to do there, and how do you make sure that someone gets that dose?
Well, first of all, the plan is going to be put in place right at the vaccination site by the public health units or by the hospitals who are running the mass vaccination clinics. And what they simply do is build a short, small standby list of people who are within 20 to 30 minutes away or could be there within a half an hour who are in that next priority. And when they've got 5 doses or 10 doses left over, reach out to them right away and make sure that we get them into those that are prioritized, that we want to get to first, and that we get them into their arms first, obviously. And so it's really simple to do, and that's what we want to occur, and that's what people are focused on making happen.
You mentioned pharmacies again, and there's there's going to be a big deluge, and you and I had spoken about this before, if the pipeline is ready to handle what will be a massive influx after the long drought. Is there a plan to make sure, again, that family doctors, that's the public system, we're already paying for that, are used maybe before we have to pay pharmacies to do this? Because, you know, we got to pay pharmacies to do it. They might need extra space. That's expensive. Why don't we just make sure we weaponize the public system first?
Well, I think we are weaponizing the public system, Evan, and, you know, I believe that we will end up paying family care or primary care providers for each vaccination or each appointment they would have. But I also would say to you that the pharmacies represent an immense capacity across Ontario, and maybe they will help us get this vaccination program done faster. And can you imagine what an economic boom that would be to us if we even could open up the province or the economy a week earlier? For, you know, that's billions of dollars. So. Right. Yeah, it'll cost to have the pharmacies do it, but it's an incredible weapon itself and an incredible capacity, and that's what we want to do. So, yeah, there's a cost. Let's bear that cost and let's get it done.
What about squeezing out that sixth dose of the Pfizer vial? I know the protocols changed. You and I had that chat a couple weeks ago on this very program, and you said you called it the bonus. It's a challenge. Now, I know we got this the smaller syringes now. Is it still a challenge? Do you have confidence you can get 6 out of every vial?
No, you won't get 6 out of every vial, I don't believe, and I'm going by, you know, anecdotal evidence when I'm out visiting vaccination clinics and talking to the people who are trying to get that 6th dose, and it's a real skill set. It does require those smaller syringes. About 80% of the time, I believe, is the number that's been quoted to me numerous times by those pharmacists and anesthetists who are all trying to extract that 6th dose. About 80% of the time in most batches, they will get that 6th dose. Occasionally, we can get a 7. We've got a protocol for doing that by mixing the vials in the same batch in a sterile environment, obviously. But you don't get it all the time. So there will be a tiny little drop. It's probably about 3.5% that we will get less in vaccines overall from that. So we'll work at it. We'll continue to work at it. We won't get it 100% of the time.
Okay, you're saying 3 or 4, but if it's only 80% of the time, there's a 20% drop, though, right?
No, if you take, you know, like let's say 10 vials at 100 per. At 10 shots per vial, just as a means of calculating, 8 times you'll get 6 out of that. So, okay. So that's all good. And the other 2, you just won't get the 6th one. So you're really down when you actually get the number of doses, about 3%, maybe a little over.
All right, finally, are you fully confident that once this big deluge hits, so we'll be able to, are you guys going to be going 24/7 to make sure everyone's getting that jab, General?
Well, it depends on if we have the vaccines that go 24/7. And what we've said to each of the public health units, there are 34 of them in Ontario. We're running the vaccination program out through them, and, you know, in their area, the pharmacies, the family care providers, the mass vaccination clinics, and the hospitals are all part of what they are going to synchronize for sure there. And they will decide whether they need to run 24/7 or 7 days a week, right, based on the number of vaccines they have at any one allocation. And if they need to, they're prepared to do that. And if they don't, obviously there's no good to have somebody sitting there, wait with an empty chair in front of them, but there's no vaccine to give. So it depends on what comes here. And, you know, we're moving fast. We're keeping the interval between the first and second needles for Pfizer extended out to 42 days. We're going to aim at 35 to make sure we don't go over. But we're also not going to keep the second dose in the freezer. We're saying when we know the second shipment is coming, or the shipment next week is coming, your second dose is in that. We know it's coming. We're confident of that. The Prime Minister has told us that the vaccines are coming. We're taking him at his word, and therefore we're going to put the vaccines we get in any 1 week into the arms as quickly as we possibly can. We'll be ready, and it'll take each time. It'll take a couple of days to ramp up to get to those kind of levels, but we've asked each of those public health units, all 34 of them, to get to a basic level of 10,000 vaccinations per day in each of those health units. So look at the capacity that will bring. It'll take a bit of time to ramp up to that. We'll be ready.
I hope so. That'd be a good problem to have. Too many vaccines.
It would be a delightful challenge.
It would be a great problem to have. General,
you got it.
Good to have you on the program, sir. Thanks for your time.